The human body has many protective systems that promote homeostasis. Physiologic mechanisms are the structural and functional defenses that protect people from stressors such as infection. When these mechanisms fail to work properly or are overcome with microbes, infection can result. After this lesson, you will be able to list indications of infection and clients most at risk of infection, interpret lab tests related to infection, discuss implications of hand hygiene per CDC, determine effectiveness of therapy, and compare and contrast multi-drug resistant organisms and new diseases. A pathogen is any microorganism capable of producing disease. Infections can be communicable or non-communicable. Communicable is transmitted from person to person. Microorganisms have differing levels of pathogenicity. This is the ability to cause disease. And their virulence is frequency with which a pathogen causes disease and its ability to invade and damage a host. The human body has many microbes that are beneficial and are known as normal flora. Each body location has its own characteristic bacteria and functions to prevent infection from unfamiliar agents leading to colonization. This is the process where microorganisms that are often pathogenic may be present in the tissue of the host and yet not cause symptomatic disease because of normal flora. Surveillance is the tracking of infections and is required by the recommended guidelines by the CDC. So let's discuss infectious agents. There are 4 factors of transmission. It requires 4 factors such as reservoir, the source of infectious agents, susceptible host with a portal of entry, and then mode of transmission, contact, droplet, airborne, vector-borne, and then portal of exit. The portal of entry can be the respiratory tract, the GI tract, the GU tract, skin or mucous membranes, and the bloodstream. Okay, let's discuss immunity. Immunity is resistance to infection. It is usually associated with the presence of antibodies. There's passive immunity, which is a short duration, either natural by transplacental transfer from the mother or artificial by injection of antibodies. Then there's active immunity, and this is long-term, and it's natural by infection or artificial by stimulation of the body's immune system. There are environmental factors that can affect immunity. These can include alcohol consumption, nicotine, inhalation of bone marrow suppressing toxic chemicals, and certain vitamin deficiency. Malnutrition, diseases like DM. Older adults have decreased immune systems. Then there is steroid therapy, chemotherapy, and anti-rejection medications. We have medical devices or surgery, trauma, radiation therapy, and burns. Okay, so now we're going to discuss transmission of infections. Direct contact is the source and host have actual physical contact, often called person-to-person transmission. An example could be the common cold. Then we have indirect contact. This is a transfer of microorganisms from a source to a host by passive transfer from a contaminated object. Such an object could be a glucometer. Then we have droplet transmission. This is an indirect transmission that may involve contact with infected secretions. Staff should stay 3 feet away from a patient with droplet infection. One example could be the influenza. There is also airborne transmission, which occurs when small airborne particles containing pathogens leave the infected source and enter a susceptible host. It's propelled by coughing or sneezing. An example is tuberculosis, maybe even chickenpox. An N95 or higher respirator mask are recommended. Then we have vectors. These are insects that carry pathogens between 2 or more hosts. Example could be a deer tick. The skin is the first and most important physical barrier to entry of microorganisms. Secondly, phagocytosis occurs if the skin is invaded, and then neutrophils are the primary players. Inflammation is an important nonspecific defense mechanism. Specific defense responses are antibody-mediated immune system and cell-mediated immune system. So if we have a break in the skin or the immune system is not properly functioning, it places the patient at a higher risk for contacting an infection. Okay, so let's discuss infection control. Hospital-acquired infection, also known as nosocomial infections, are infections that are acquired in the inpatient healthcare setting. It can be endogenous or exogenous. The most important thing is hand hygiene, the use of personal protective equipment, adequate staffing, disinfection and sterilization, and patient placement and transport. The CDC's recommendations for infection control include hand washing. That includes wetting, soaping, lathering, applying friction under running water for at least 15 seconds, rinsing, and adequate drying. If your hands are visibly dirty or soiled or feel sticky, or if you have just toileted, wash your hands instead of using alcohol-based hand rubs. ABHR are ineffective against spore-forming organisms. One example would be C. diff. And also, the CDC recommends nursing staff should consist of full-time nurses assigned regularly to a unit rather than a float pool or agency nurses. Infection rates go up when these alternatives are used. The CDC also recommends that private rooms be used for patients on airborne precautions and those in a protective environment. Okay, so we're going to discuss a few multi-drug resistant organisms. These include VRE, VRSA, MRSA, and VISA. You need to know the appropriate drug therapy for these drug-resistant organisms. Most cases require a CNS test. Also review examples of bioterrorism agents on Table 25-5, page 448. Also see Table 25-6, page 455, for emerging infectious diseases in the United States, pandemic infections, and food contaminations. Okay, so let's discuss some precautions. Standard precautions reflect that all body excretions, secretions, and moist membranes and tissues, excluding perspiration, are potentially infectious. Transmission-based precautions depends on the organisms, whether it's airborne, droplet, or contact. You got to realize that when a patient is placed on isolation, they are at a risk of social isolation. You want to provide education for the patient and the family, and you want to encourage contact with proper precautions and spend time with the patient. Okay, we're going to discuss a little bit about collaborative care. We're going to cover lab, imaging, and drug therapy. During lab, a culture and sensitivity testing is performed to determine the effects of various drugs on that particular organism. Then we have the rapid antigen detection. An example would be a rapid strep test. We will also do a CBC with differential. You want to monitor for shift to the left of the immature neutrophils. You will also monitor the ESR of being greater than 20. And you will check serology, the antibodies to an organism. Imaging can require a chest, sinus films, joint films, and GI studies. There may be a potential for a CT or an MRI to assess for abscesses. So drug therapy may include anti-infective, antimicrobials, antibiotics, antivirals, and antifungals. To be effective, it must have the appropriate drug, the sufficient dosage, the proper route, and a sufficient duration. And it will work by inhibiting cell wall synthesis, injuring cytoplasmic membrane, and inhibiting biosynthesis or reproduction, and or inhibiting nucleic acid. You want to watch for nausea and vomiting and rashes. Antipyretic drugs such as Tylenol you only want to use if the patient's very uncomfortable or the fever presents a significant risk. Intervention may also include external cooling and fluid administration. Shivering actually indicates the patient is being cooled too quickly, and you want to watch for signs of dehydration. This concludes the lesson on infection. If you have any questions related to this lesson, contact the instructor.